To begin your work during this module, I'd like you to complete a brief reflection activity. You can, when I ask the reflection question in a moment, you can pause your video and just write down your answer or type it out, whatever's most convenient for you. Take a moment to reflect. What is the difference in your mind based on your understanding of your own life, your own experience, and so on? What do you think is the difference between sadness and depression? Go ahead and pause the video and just write down or type out whatever comes to mind. So you may have explored or wrote about the difference between these two experiences, maybe in terms of their duration. For example, you might have wrote that depression is an experience that maybe has more chronicity or lasts longer than the temporary feeling of sadness or the transient feeling of sadness. Maybe you reflected on how these experiences might differ in terms of their cause, or maybe in terms of their severity or their impact on day-to-day life, or how we might feel about our life and the degree of distress that might be inherent in those two experiences. One of those experiences, sadness, is something we might label as typical or normal. And depression is an experience we might label as disordered or problematic, or in some way, some type of condition, or some experience that might indicate that we might be in need of healthcare in some way. We're going to explore how we differentiate and the line that we might draw between experiences that, on the one hand, we as society view as typical and normal, and experiences that we identify as potentially problematic or disordered, the label we might use for those experiences most frequently as psychological disorder. It's a really important question, how we differentiate between those two experiences. So consider that when we label an experience as disordered, such as the case of the experiences that make up the pattern of thinking, feeling, and behaving that we label as obsessive compulsive disorder that you learned about during the previous topic, the impact that has. It means that we might then devote resources as a society toward prevention and treatment efforts. We might try to develop new, more effective methods of helping people who experience that pattern of behavior and psychological experiences to change their behavior, because we might view that pattern as problematic because it causes suffering and distress for people, and we might have a desire to help people relieve that distress and to increase their well-being in the context of that experience. Consider, too, the harms that might come with labeling experiences as disordered when they're not actually a problem, or they might not be inconsistent with typical development, for example. So for example, consider that up until about 1980, there was a diagnosis in the Diagnostic and Statistical Manual for Mental Disorders, the main diagnostic manual in the United States for psychological disorders, called homosexuality, that labeled same-sex attraction and behavior as a disordered experience. That misapplication of the label of disordered in that case caused profound levels of harm, both for the people that experienced that label of disorder in that context and for society as a whole. Now, we've since corrected that error, but there are other diagnoses currently in the DSM that most psychologists would agree that are experiences that aren't actually disordered, for which labeling them as disordered is harmful, such as the diagnostic category of gender dysphoria that mislabels identifying as a gender not consistent with the gender assigned at birth as disorder. In this way, the way that we differentiate between normal and abnormal, or normal and disordered, is important. And we're going to explore how we go about doing that. What criteria do we use to define disorder and to draw that line between typical and disorder? To begin working through that, you're first going to complete an activity where you're going to look at some examples of behavior, and you're going to attempt to determine whether you think those are normal or disordered as a way to begin thinking about this issue with some concrete examples. You're then going to watch a lecture, an online lecture, and do some reading that will address this issue. And then you will use that information to complete an assignment at the end then of this topic, where you again look at some examples of behavior and apply some of the concepts that you've been learning to them. If you have any questions as you're working through this module, please feel free to email me and or to set up a meeting if you'd like to discuss anything from this module.